Am I on?
Yes, I can hear you now.
Yeah,
Okay.
should be ready to go.
Did you want us to start now? It's 7.
Yes, please continue.
Okay, Kate, we're ready.
Okay, great. Can you see my screen?
Yes.
Okay,
Yes, we can see you, Kate.
great.
You have to unmute, Deborah.
Thank you. Good evening, ladies and gentlemen. It is so wonderful to see your faces and see your names or see your pictures in the squares once again. Thank you for being here with us this evening. On behalf of the St. John Community Development Corporation, Incorporated, we would like to welcome everyone to the Community Voices 2, addressing the Wilson Opioid Crisis Forum. Your community voices had questions, and we have community leaders responding to your questions. We would like to thank all of our elected officials for joining this evening. And we are asking you if you would either put your name or raise your hand in the chat so that we can recognize you on this evening. We extend a special welcome to all of our panelists, and we are excited to have them to join us this evening. I hope that this evening discussion will inspire you to make a difference in your community and seek the resources that are readily available. We are also asking everyone to please remain on mute during the forum to minimize noise in the background. And to please type your questions in the chat, and they will be answered during the Q&A time at the end. I also would like to welcome our panelists, Sergeant Turnage from Wilson Police Department, Jeff Hill, Director of Wilson County Substance Prevention Coalition, Sheriff Calvin Woodard from Wilson County, and yours truly, Deborah Power from Wilson County School Board of Education. So again, I hope you sit back and enjoy the program.
Let us pray. This evening, God, we're thankful for the many blessings you bestowed upon us. Thank you for your grace and your mercy and this opportunity that we can gather together, God, to communicate and to learn and to hear about the various initiatives that are focused in the area of opioids, which is attacking our communities. God, thank you for these leaders and these individuals who represent various aspects of our community and able us to hear and to identify ways that we can then become engaged and involved. God, thank you for the elected officials and those who are championing policies that can affect the opioid crisis and how it is impacting our communities. God, let us open our eyes and our ears to be creative and innovative in ways and in strategies that we can connect together across racial lines, across ethnic lines, across all of the things that have divided us, to then understand that this is about community. We thank you for your leading us and for your guidance. And it's in the matchless name of Jesus the Christ we pray. Amen.
I want to, first of all, thank everyone for being part of this second Community Voices. I am Dr. Lamont Foster, Executive Director of St. John Community Development Corporation, Inc. And when I was transferred here by my bishop to St. John AME Zion Church, I'm going to find out that my grandfather is from Black Creek. I got a special interest in it. And then I asked the question, what can I do to be impactful and do something to support and to edify this community? And as I began to look around, I noticed the increase of opioid use and deaths. And so it brought my attention to what can we do to address the problem? Well, I wrote a grant to Z. Smith Rental after researching to see if I could find some funds that will help me to do this. And Z. Smith Reynolds was doing taking grant proposals dealing with systemic change. And so part of the grant approval was to address the problem of systemic racism, systemic oppression, anything that caused the system to malfunction. And so as a result of that, the grant was approved. And part of the second piece is to establish a Center for Systemic Change. And that will be our next project before our final vision, our next project with Community Voices 3. And so we look forward to you sitting back, enjoying it. I gave Dr. White, Carol White, and Mrs. Vetus Neal my vision and what direction I want the second Community Voices to go. And this is a result of their collective work. And so if it's anything like the first one, you will thoroughly enjoy it. So thank you for taking the time out to come to hear what our servant leaders have to say about this epidemic we find ourselves in. Enjoy.
Can you hear it?
No.
Okay,
Can't hear it.
sorry about that. One moment.
Hi everyone, my name is Amber. I'm the clinical
That good? How about now?
Yes.
Okay, great.
director at Wilson Professional Services Treatment. Hi everyone, my name is Amber. I'm the clinical director at Wilson Professional Services Treatment Center. We are located at 3709 Nash Street Northwest, Wilson 27896. We treat individuals who are 18 years of age and older that meet the criteria for opioid use disorder. We utilize medications such as methadone and buprenorphine, as well as individual and group therapy to help battle this addiction. We do accept Medicaid and Medicare insurance. We do have state funds that are available for those that qualify. We here at WPS are committed to promoting the highest level of professionalism and utilizing the best practices to ensure that all of our patients receive the best quality care in a safe and therapeutic environment. For more information, please give us a call at 252-206-5799 or visit our website at www.wpstreatments.com. Thank you so much.
That contact information, as you can see, is on the screen at this point. If you want to take a screenshot, use your phone for a screenshot in case you want to pass that information on with someone or share. Thank you.
Okay, I will go to the next slide unless anyone needs a little more time.
Good evening, everyone. Thank you so much for coming out this evening so that we can learn more in order to strengthen our communities. Can everyone hear me? It is my pleasure to let you know how fortunate we are to have knowledgeable citizens from our community to take out time to help address our local issues and prepare us to become a more informed community. We have Sergeant Tyon Turnage from the police department, and Sheriff Woodard from the sheriff department. That pair, that partnership there will assist us and strengthen what we will hear from Mr. Jeff Hill from the Wilson County Substance Prevention Coalition. We are so fortunate to have them, and we thank you for taking time out of your busy schedules to come this evening. Next slide, Kate. And representing our community this evening as our moderator, we have our own representative, Linda Cooper Suggs. We are truly blessed to have her this evening. With all the things that she has on her schedule, she has given time for us to come and help inform our community. Linda, Representative Linda.
Mrs. Neal, thank you so much. Thank you, Dr. Foster, to Dr. White, to all the panelists, to Dr. Jeffrey Sims. I haven't seen you in a while, but it's good to see you. To all of our illustrious panelists this afternoon, I know that what you do is extremely important. And what's going to be said here tonight is going to be important too, as well. So we want to start to dig in real quickly because we know that the opioid crisis is major. And even 1st of June, there was an article within the Wilson Times, as well as which indicates that there has been a rise, especially because of COVID, but there was a problem that existed even prior to that. And COVID only exacerbated the entire issue. So we're going to get started this evening. And remember that if you have any questions, just remember to place your questions into the chat. And as we finish this segment, Dr. White will in turn share those questions, and then we'll have each one of you to respond. Tonight, the format for our panelists tonight, Wilson Police, Sergeant Turnage, our sheriff, our own Sheriff Calvin Woodard, Jeff, as well as the Honorable Deborah Powell. You're going to be answering questions. Some of you will be the lead for these questions, which means you have 4 minutes to speak. And if you need to press it to 4 minutes and 15 seconds, I think that'll be all right. 4 minutes and 30 seconds, we can live with that. And then I will ask the others to respond within a 2-minute response. But first, we're going to start with question number 1, and this is for everyone. And this question is like a minute. I just need to hear your responses to this question. And the first question is, what we want to know is, what impact has the opioid crisis had on Wilson County citizens, our citizens, especially families and our children? So I'm going to start first with you, Sergeant Turnage, followed by you, by Jeff. I'm gonna follow you next, Sheriff Woodard, and then the Honorable Powell. If you want to answer, you can answer this one as well. Okay. Sergeant Turnage. I need you to unmute for us.
I apologize. Good evening, Sergeant Turnage again, Wilson Police Department. With the question of what impact opioids have had, it has a major impact on the communities here, all communities here in Wilson County and the city as well. If you think about the way that this drug is used to cut other substances such as crack cocaine, powder cocaine, and other things, opioids are used as a painkiller, and what it does is it has an effect, an addictive effect, in which a person needs it in order to feel good. And that means that if a person is addicted to it, they get sick without it. And that causes them to try to get it in so many different ways because they don't want to be sick. So that's a dependency there, if you think about it. So the dependency drives them to do other things to get it, which is commit crimes in order to get this drug. So that leaves the person out to commit robberies, larcenies, other crimes, and it also messes with their mental state as well. And that has a domino effect in the community here, in any parts of the community here. And it affects the lives of children, their loved ones, law enforcement, other citizens as well, because these are victims here of this opioid crisis here that we're living in. If you think about opioid deaths, back in 2017, 59% of opioid deaths was by multiple substances, and that includes things like opioids such as fentanyl, which is a painkiller used in a medical setting, carfentanil, which is 100 times more potent than your fentanyl agent there. And these street dealers don't know how much fentanyl to use in their cutting agents when they're trying to cut with cocaine and use it in crack to make their stuff even more strong. So with that being said, that causes them to use too much, which in turn causes deaths. And these people are, of course, wanting the biggest effect that they can have and to buy the best stuff. So in essence, if you have the strongest, what the street term is going to be dope, the more it's going to sell. And the strongest dope is going to cause people to overdose. So that causes deaths. And that leaves.
I don't need you to say everything yet because you've answered,
Yes, ma'am.
you've already answered a couple of more of my questions that I have
Okay.
this evening. Okay.
Yes, ma'am.
So just 1 minute, and I need to hear from Mr. Hill next, followed by Sheriff Woodard, and then the Honorable Deborah Powell. Okay, but hold on to some of that information. We need to come back to it. Okay. So you give us an introduction and how it's really how it is affecting our communities.
Yes,
and
ma'am.
how it actually works. So, Mr. Hill, Jeff, will you respond to the same question? What impact has this crisis had on the Wilson community? And we know Wilson, not just the city of Wilson, but all of Wilson County, especially our families and children.
Yes, ma'am. So first of all, thank you for allowing me to be a part of this in our coalition as well. First and foremost, I'd like to say that addiction, whether it be opioid or other, affects not only the person who's addicted, but everyone around them. The biggest piece with that is when you talk about children and families, specifically within the home. In Wilson, we also see intergenerational use, which means that there have been generations of use within a home, which is something we also have to address, the commonality of it, the rationalization of it. Just to give a quick statistics on some of the data we have for one of our grants, just in April alone, we had 17 community members who were diagnosed with opioid use disorder. We had 9 babies who were born with neonatal abstinence syndrome, 12 non-fatal overdoses, and 32 other non-fatal overdoses that include multiple substance or polysubstance use. A piece that Sergeant Turnage hit on as well is the way that opioids are cut, specifically street level opioids. Not knowing what you're getting is one of the biggest dangers that you can have when it comes to substance misuse or substance use in general. We tell people it's like playing Russian roulette because you never really know what you're getting your hands on. So our job as community leaders is to not only share this information, but to also put things in place to ensure that people do have resources and things as well, which I do believe Wilson is very well positioned to do. But in reality, again, opioid addiction and addiction in general has impacted families, it's impacted children. You see homelessness, you see joblessness, you see lack of income, because the fact is that when someone is addicted, the brain rewires itself. And addiction becomes first and food and shelter becomes second. And that is one of the biggest priorities that we like to address when it comes to addiction and its effects on our community at large.
Thank you so much. Sheriff Woodard, what would you like to add?
First of all, as always, we'd like to thank you for allowing me to be with the program, and definitely thank you, Dr. White and others. Just as far as from my perspective, like the gentleman said earlier, Sergeant Turnage is enlightening us on a lot of things. I just want to say from my standpoint, my point of view, it has caused, we got a lot of mothers who are victims out here from the, and what I consider human trafficking, where children are born, and that's due to them getting out here and being hooked on opioids and trying to do things or allowing others to utilize them to doing things in which they're having children so they can go ahead and help their habit, which also like it leads the children out here in a sense of where we, the system based, and I hate to utilize it like that or say it like that, will have to take care of them. Well, personally, I don't feel like that's fair to that person as well as the people who are actually having to go through it, like the families, of course, the kids and those who are taken away from that. And I'll talk about that piece later that are incarcerated from that. And then also I want to just go over the psychological piece in which it not only affects the families and the citizens, it also affects law enforcement because a lot of our law enforcement, sheriff's office, police department, highway patrol, and other agencies are citizens of this county as well. And we have to go to these calls where people may have overdose and they're unresponsive. We had to utilize CPR sometimes for EMS get there, in which that's a psychological effect that affect us as officers that a lot of people are not actually familiar with, along with our other jobs that we have to do as far as protecting and serving the community. So you take that to affect the law enforcement's home, where it goes into his home with his wife and his children, or her husband and their children. And it just makes the whole opioid issue very damaging for the whole entire community. But as we go further into it, there are a lot of things I feel like the community is doing as a whole, not only just law enforcement, but other stakeholders, which is ensuring that our community and our county is not like, and I'll just be honest, other counties, because I feel like we have a strong impact, a strong hold on the way things are going by working together. However, we still have a long ways to go.
Thank you so much, Sheriff Woodard. Thank you.
Yes, ma'am.
Thank you. Mrs. Powell, is there anything
Yes.
you'd like to add to this?
Yeah.
Deborah, I can't hear you, Deborah. Deborah, we can't hear you.
So different from their own educational experiences.
Okay, Deborah, hold back. If you could start again, because I was unable to hear. We don't want to miss anything.
Oh, okay.
Everything that's being said, even up to this point, is so vital and so important for all of us to know. So if you'll start again, please.
Okay, thank you. Yes.
Thank you.
We, Wilson County School System, we see the impact of the opioid crisis in our schools with family members, assisting their adult family members with a severe drug usage. Sometimes they have difficulty navigating our education system because it's so different from their own educational experiences. Our school social workers and school counselors provide support to the student to support good attendance and academic performance. School counselors, which we're really proud of how well they work with our students, have also supported our students who have lost family members due to the opioid crisis. So we have the resources available for our children if needed.
Guys, thank you so much for all of those introductory statements. And you've truly set the tone for tonight's forum. You truly have. Let's continue with our next series of questions. And part of it has already been touched on because it begins with, first thing, as Sergeant Turnage said a few moments ago, I need you to review this again for us. What is an opioid and what are some of the signs of abuse? Mr. Hill, I'm gonna start with you first. And you have a lead of 4 minutes. And then I'm going to ask the other panelists because they only have 2.
All right, thank you very much. So opioids in general, opioids are a class of drugs that are naturally found in the opium or poppy plant that work in relative conjunction with the brain to produce a variety of effects that include pain relief as well as euphoria in different circumstances. Opioids can be prescription medications, also referred to as painkillers, but they can also be street level drugs such as heroin. Many prescription opioids are used to block pain signals between the brain and the body and are typically prescribed to treat moderate to severe pain. In addition to controlling pain, again, as we stated, opioids can make some people feel very relaxed, happy, or quote unquote high, which can also lead to addictive behavior and personality traits. Opioids by name are often referred to such as Oxycontin, Vicodin, hydromorphone, and morphine. There's also a synthetic drug that Sergeant Turnage touched on earlier, which is fentanyl and carfentanil, which is 50 to 100 times more powerful than even morphine. And then you also have heroin, which is an illicit and illegal street drug that is commonly misused with opioid addiction. The signs, however, of using opioids can vary depending from person to person. You can see symptoms ranging from mood to behavioral to physical and physiological and psychological changes. What we tend to hit on is that with the mood in particular, you tend to see possible depression, anxiety, irritability, elation at times, and even relaxation and at times anger. With behavioral trips, you're looking at sudden physical problems, borrowing or stealing narcotics from friends and family, lying about the amount that's being used, slurred speech, lowered inhibitions, poor judgment, a lot of things that we tend to characterize or stigmatize with addiction in general. Physical symptoms can be bloodshot eyes, constipation, sleepiness, difficulty urinating, itching, flushed skin, leading to liver disease, jaundice, coma, and even death by overdose. And finally, psychological. Obviously, addiction is a mental and a physical dependency. So that is a psychological and a physical factor. Confusion and or unknowing, being unaware of where they are. Psychological dependencies was stated, hallucinations, delusions, and paranoia. Long story short of it is that an opioid in general is going to affect every aspect of your body and the way that your life is functioning. What we tend to tell people is that the signs are very common. And what we mean by that is they can be seen as something that they're not. So when you look at things like nausea, vomiting, diarrhea, these are all symptoms of not only opioid addiction, but withdrawal. And noticing the difference between the two is also a very vital point. With withdrawal, you see things such as muscle aches, anxiety, restlessness, as was stated earlier, diarrhea, cramping, rapid heartbeat. You can see high blood pressure, dilated pupils. And a lot of these symptoms that you're seeing can be either obviously from an addictive piece, or also could be from a medical or a mental disorder that's already been previously diagnosed. Our biggest thing with it is that we tend to tell people to focus on people, places, and things. Are they changing any habits or any scheduling changes? Are they around new people, hanging out with a new group? Or are they interested in things or showing less interest in things than before? Because when you begin to stumble down that road of addiction, 9 times out of 10, you begin to not care so much about things that matter to you as much as they did in the past. You may not take an interest in work or school or something that you may have prioritized. And these are very detailed signs that obviously there is an issue within a person's life that needs to be addressed, whatever that may be. The other piece of this really with what we tell people around opioid addiction and kind of picking it up is that, for lack of better terms, with somebody who is actively misusing opioids, we do tell them, hey, make sure you're checking prescriptions. Make sure that if you're even visiting a friend's home, have them check your prescriptions. Make sure things are locked in accord and make sure there's a count, because you never really know. And what we tell people is that with addiction in particular, we tend to stigmatize it and think it's that homeless person living on the street or the person that's trying to break into my car. But what you don't realize is that it could be that mom or that dad, even that grandmother. It could be somebody that's coming in to work on your cable or to quickly install something for you. You never really know, because some people function better than others. But the biggest thing that we can say around it is that 9 times out of 10, if it's someone you love, you know them. And if there's a change in their personality, it's always something that we ask to be addressed, whether that be a mental or a physical issue. And taking that path, 1, could lead to a conversation around a dependency or a misuse, or 2, it could get them to a resource to where they could underlie things. And the last thing to speak on with this is we speak a lot about addiction, but we don't talk about underlying causes. And other things that go with this is that I've never met a person that said, I woke up one morning and decided to be an addict. There's been something down the line that has pushed them towards this lifestyle. There's been something that could be, and I know we'll talk about more of this later, but it could be a traumatic experience. It could be an adverse childhood experience. It could be a slew of things. It could be a mental health diagnosis. There's also genetic traits that fall into line with this. So making sure that you're monitoring these things and working with people to make sure that if things do change, they can be identified and then obviously addressed. But that's just a very brief and quick overview of what opioids are and a few of the signs for opioid use or misuse.
I just want to say thank you, and I know all of us say thank you as well to everything that you've shared with us, and to make it so practical, even with someone coming into your home to make a repair, the importance of just putting everything away. Well, one thing that we have to monitor, but thank you so much. One thing that we have to monitor tonight is the time. So Dr. White is going to be the person that holds up the 1-minute card and then a 30-second card to let you know that your time has ended. Okay? Sheriff Woodard, will you continue? Okay, what is an opioid and what are some of the other signs of abuse?
Okay, Yes, ma'am. A lot of the signs that we've noticed is, and what I've noticed rarely, would be actually the denial. A lot of times the families, they're in denial that they don't want to say, and it's also embarrassment that they don't want it to be noted that their family, depending upon their economic status or financial status, are using opioids. And a lot of times we run into that with law enforcement, where we may have someone who are obtaining these opioids from a family member, whether it be pills other than the opioids, as far as heroin, and they're using those to go support their habit and also make money from their habit. And so a lot of times it's just making people aware of it and showing them that they don't have to be afraid, because all of our opioid overdoses that was going to insure us off investigate if there's regardless of the outcome of the investigation. And we have actually made some arrests behind it. And I know, of course, the Wilson Police Department has as well. And that's just a law enforcement piece, but I'm pretty sure we also have the community piece, where we get out here and we try to educate not only the families and show them that there are resources out here that they can go to, as well as also educate our children so that they won't fall into that path as well. And again, that's my only two pieces that I see a lot as far as the signs of it is actually the denial, the embarrassment, and then where families, they just basically break up due to it. But regardless of all that, it's still, I think a lot of our families, a lot of people in our community will actually come to grips with that. It is a problem, and we come together. I'm pretty sure, again, we can make an even stronger impact on it as we are now.
Thank you so much. The Honorable Powell, a response?
I'm sorry. Yes, I agree with Dr. Woodard when he, Sheriff Woodard, when he said that education is very important in letting our students know that there are other choices out there. Education, letting them know that there are other means and other resources to help them. Because sometimes our students are faced with the situation and they feel there's no other way but to follow in the footsteps of their parents, of their grandparents. But let them know the cycle can end and there are other ways to assist them. And as you said earlier, too, that a lot of times the person that has become the addicted person, there's been something traumatic in their life to cause them to do this. And it's just finding out what that underlying factor is and supporting them and helping them. It's just the same as when you have a food addiction. You know, a lot of times people they eat food continuously to relieve them from that stress. It makes them feel good. And the same thing as a drug. So if we can educate, get the resources out there, to let it be known that there are other ways and other avenues. And if you are in a certain situation, that you can get help, and there's people out there that can do it. So thank you.
Thank you so much. And lastly, Sergeant Turnage, is there anything you would like to add in regards to what is an opioid and what are some of the signs of abuse?
Yes, ma'am. Everyone pretty much touched on the definition of the opioid there, so I'm not going to harp on that much more. But for me, opioids also, if you want to add, as we said earlier, that we've seen in the community mostly is going to be your pills such as your oxycodone, your hydrocodone, and your carfentanil and fentanyl. That's what we're seeing mostly. The carfentanil is a synthetic form, as we said earlier, in the fentanyl. I say those two a lot because we're noticing that those drugs are used mostly to cut pills and increase the potency of them. And this is what's causing most of your death, is because these people that's making these drugs, they're not doctors, they're not pharmacists, so they don't know how much to use. So when I think of an opioid, now that we're seeing most of it, going to be those, as well as these prescription drugs that's used, that's readily available over the counter, because people are able to get these because of accidents or things that happened in the past that caused them much pain. If you think about opioids itself, they're used to treat moderate to severe pain, and something like morphine, something like fentanyl, used in surgery at times when patients have it. So when you think about a surgery and they're using these drugs for surgery, think about how strong they are and how they're used. signs of abuse that I've seen in law enforcement, and I can only speak in law enforcement here, is I've noticed that you'll see a lot of needles, you'll see a lot of marks and things. People are getting hip to the game of marks as well. And the introduction of these drugs are through, they use needles between the toes, so you won't be able to see these marks. And that's something significant because, as Mr. Hill said earlier, that is when you don't really know or see the signs, because people are able to hide it very well. And they're very functioning in their jobs. And these are people with professional careers as well. However, always pay attention to the person's baseline activities, as stated before. Also, if their baseline behavior is out of the norm, you can notice this on certain days. And when we get what they call dope sick, you can notice when they're dope sick, they sweats and chills and scratching and things like that. So pay attention to your loved one's baseline behavior and people that surround you, their baseline behavior, because they will also always display certain symptoms and signs that will make you aware of this drug.
Thank you so much for everyone responding to that question, because I'm gonna tell you, we need to get all this information out to our community so that others will hear what you're telling us tonight. Sheriff Woodard, I'm gonna start with you as the lead this time. And I want you to talk about how have drugs such as opioids impacted the incarceration rates here in Wilson County?
Again, thank you. And I'll also put my timer on as well, so I can't get long-winded. But as far as opioid and the rates in incarceration, it has been a big impact since the opioid crisis started occurring, because a lot of times people are doing a lot of things trying to be able to pay for the drugs, whether it be something as minimal as misdemeanor larceny to something just as strong to robbery, armed robbery, or even murder. And a lot of times when these people come into the detention center, they're coming into the detention center. Some are coming down off their high. Some are just originally went into their high possibly, and then some of them going through withdrawal, which plays a huge impact on not only the medical authority, but also the officers who have to move the people who have substance misuse disorder from one place to the other throughout the detention facility. A lot of times, as Mr. Hill said, they may go through some psychological issues, some mental issues, and then some out of anger issues. And so again, the officers, and I know I'm going to another piece real quick, have to make sure they're trained to be able to handle that. And then again, some are placed on the high bonds, and the detention center, I've always said, is not the place to have people to try to get them treatment. However, we do have a medical authority that can assist them in that, whether it be talking to someone or administer or send them out to some medical facilities or mental health facilities to try to get some form of treatment. But with them sitting in there on the high bonds, it's not helping them at all, and they're in there based on not knowing, some of them, what they were doing at the time. And I know I'm not the lawyer, I'm not trying to talk up for them, but a lot of times people who come inside the detention center through their interview questions when they come in, so, have you used drugs within the last hour? Are you on drugs? When was the last time you used it? And a lot of them go into the thing of using some form of opioids other than some like your gateway drug, which is like your marijuana. In addition to that, it's a burden on the taxpayers, because taxpayers have to foot that bill when that person comes in there on a high bond because of having this substance within their body, and sometimes due to reasons they probably don't even know why they did it. And then we have to pay that burden, because from their medical costs to their mental costs to anything that, if they fall and hurt themselves due to coming off their high. But again, we do have recovery coaches within the detention facility, which I'm thankful of, that can assist them with that. But during the COVID, the rate started going down just slightly as far as incarceration, but a lot of that was due to the, people, being home more, people not doing much travel, the money issues. But then, of course, I'll just be honest, whenever the money issues started coming back up to where, people getting substance to assist, we have noticed a slight increase in the opioid issue within the county then. And I won't elaborate too much on that, but we have seen some of that. But again, I'm still thankful that Wilson and all the incorporations within Wilson County is still within the levels of not within the state level, and not as bad, I feel personally, than other sheriffs that I hear talking about their issues that they have in their counties.
Thank you so much. Thank you.
Yes, ma'am.
The Honorable Powell. Anything to add that you'd like to add before I move on to Sergeant Turnage?
Nothing to add. Thank you.
Okay, Sergeant Turnage.
Yes, as I see when it comes to the opioid addiction, addiction causes, as I said earlier, it causes a snowball effect as far as needing it and being dependent on it. When a person gets dependent on it, they don't want to be sick. So what they do is they do anything to get it. That includes larcenies, that includes robberies, that includes also they start selling it themselves. So they sell it to be able to get their own to support their own habit. So with all of these crimes, these are what we call our partner crimes, which also increases the crime rate and increases the incarceration rate due to their dependency and their need for it. So that addiction itself caused the need for it, and the need for it is going to cause people to commit these crimes, which is going to be some of the most heinous crimes at the time, and which is going to demand some jail time and prison time. So there's always a correlation between crime and poverty, if you think about it. And that's what we learn in criminal justice, a correlation between crime and poverty. So when a person is addicted to a opioid in which their body need it and their body is dependent on it, and they don't want to be sick from it, then they do anything to get it. And when they start doing anything to get it, that anything is going to be to commit these crimes, which is a snowball effect in which then they run into law enforcement, in which incarceration rates increase due to their addiction.
Thank you so much. And Mr. Hill, could you respond?
Yes, ma'am. I'll be very brief because I think that Sheriff Woodard and Sergeant Turnage did a great job, as well as Ms. Powell for touching on everything. But for us, the biggest thing is, like we said, addiction changes the brain. And when we talk about that, it makes us act in ways that maybe we wouldn't have in previous, instances. So the way that we say as far as incarceration rate is that addiction is going to impact the incarceration rate because addiction is what's driving this person, like Sergeant Turnage just said. There is an underlying mental health factor that is driving them to find a way to secure whatever drug or whatever intoxicant that they are looking for, and whether that be over the counter or illicit. So for us, the biggest thing is that the more usage you see, as Sergeant Turnage said, you tend to see a higher crime rate. So, but again, I don't want to put that specifically on opioids as much as I want to say about addiction in general, and polysubstance use as well within the county.
Okay. Since we're talking about addiction, let's talk about some resources. And Deborah, I'm gonna start with you first, if you'd begin with this one, followed by, and this is just a 2-minute question, everyone. Okay, followed by Sergeant Turnage, and then Mr. Hill, and then Sheriff Woodard, you're gonna be last on this one. Let's talk about some of the resources and programs that we have in Wilson County to prevent or to support those persons dealing with this addiction.
Yes, thank you, Representative Suggs. Wilson County Schools is in partnership with Wilson County Substance Prevention Coalition, as well as community-based mental health services, to provide a list of resources to prevent and support addiction. Additionally, East Point, which is our local management entities, managed care organization, and are responsible for managing the care of beneficiaries who receive services for mental health, development disabilities, or substance use disorder, which may contact for assistance.
Thank you so much. Sergeant Turnage.
Yes. So here at Wilson Police Department, our narcotics unit usually do what we call the pill drop. And that's when you have pills that's out of date and you have pills that's laying around, that you can drop those pills off and we can figure out a way to dispose of them. That is something that we've been doing since I've been here and I can remember. We also have through other resources and other agencies, the syringe exchange program, in which we can take the syringes and, the program that they use to exchange the syringes. We also, each officer here at our agency here carry what they call Narcan, Noxalone. And that is something when you respond to the scene and you see an overdose or something, we can administer our Narcan through the nose, and it's something that assists in bringing the person back, as well as here in our community we have the availability of Noxalone as well. That can be given out as well. So we also here have educational programs as well as far as going out to schools and different community groups and places to educate people on opioid epidemic that we're facing.
Thank you so much. Jeff?
Thank you. The coalition focuses on prevention, treatment, and recovery. So we tend to try to offer resources around all three. With prevention specific to opioids, the coalition itself is a prime member in the North Carolina Lock Your Meds campaign. The coalition itself purchases and provides medication lock boxes, lock bags, and cabinet locks, as well as in-home disposal kits at no charge to our community members. All we ask is that you call, let us know that you need one. If you have a transportation issue, we'll even try our best to get it to you. With recovery, we do have a recovery center here in Wilson. It's where I'm actually located now, called RC3, or Recovery Concepts Community Center. We're open every day from 10 to 4. And we are just a safe, sober environment for somebody to come into to do everything from go to an AA or an NA meeting, to go to a Easy Does It Cafe, which is an open mic night we do every Monday night in a safe, sober environment. And we even do something called Art Through Recovery, which is basically wine and design without the wine. Teaching people what it means to really enjoy life and thrive in sobriety. And then finally, in partnership with the Wilson Police Department, as well as Wilson County DSS, the Flynn Home, East Point, there has been the Crisis Center, the United Way, a ton of community partners have stepped up to help us with an initiative called the Hope Alliance. And what the Hope Alliance is that it's a treatment access point that Ms. Shannon Nichols heads up brilliantly on our behalf. And what it is that the coalition, as well as many other countywide partners, actually apply for funding that can be used to help people get into an inpatient, outpatient, or detox facility for treatment purposes. We even cover transportation costs. So there are a plethora of prevention, recovery, and treatment resources that are available to our community here in Wilson County.
You know, it's so good to hear that our community is being taken care of, because this problem it's a major problem because it affects families and just the quality of life for so many individuals. Sheriff Woodard, do you have anything to add? What resources and programs?
Yes, ma'am, and I'll make it real quick. The pretty much like what Sergeant Turner just said, we do have the Project Zazarus, which is like a drop box here at the Sheriff's Office, as well as with the Police Department. And we also, at the Peel Drop, we do assist with that with the Sheriff's Office once to twice a year. And of course, the Narcan carried by the senior level and other officers within the Wilson County Sheriff's Office. And like I stated before, we do follow up on all drug overdoses, trying to follow it to the source and possibly, you know, I know people always say, well, you know, if you take away the source and they can go somewhere else. Well, we still do that because I try to keep my officers motivated to where even if we take away the source and they have the substance misuse victim goes to another source, it kind of try to make it harder and harder to where maybe they'll stop at one point and try to seek and say, well, you know what, maybe this is not the way to go. Because again, just arresting them, placing them in jail is not the answer. We try to inspire the youth through our PATH program. I know, of course, Sergeant Turnage in the Police Department had the PALS program, which is a great program as well. And through our great program, well, the superintendent has allowed us to go into schools for the last 10 years, where it's gang resistant education and training, where we go into the schools ages within the 6th and 7th grade, try to talk to them about, you know, being a good citizen, good moral character, not alluding to drugs or going that route, staying out of gangs, anything that can push them within that realm where either they're using or they're selling, and then they're selling and then start using. And also, last but not least, we have 2 recovery coaches in the detention center, which are certified to work with inmates within the detention center. And 2 of my drug investigators are recovery coaches who, even though they may arrest that person for drugs, whether it be someone who's using drugs who we just happen to catch coming from the dealer's house, whatever, we can also try to point them within the right direction to try to get some type of help or assistance for them.
Thank you so much. Thank you so much. Let's move on. Sergeant Turnage, I'm gonna start with you next. And what we want to look at is the training that our law enforcement receives to respond to these different situations that involves addiction or drug use? And you've given us some excellent examples now that the compassion and heart that you have for this community, and that it's not just a job. And what would we do different? What type of training first? And then what do you think should be done differently?
Yes. Well, here I'd say in the Wilson Police Department, and I've seen in the county as well, we try our best to follow up on every lead that we have as far as opioid overdose. We see that we look at the person or the victim. We call them the victim because they're a victim of this overdose here, and we look at them as a victim and not an offender in this incident. Because if we look at it that way, we look at them as the victim of that addiction, and then we can start showing more compassion to solving these opioid overdoses. So as far as the training is concerned, we start with that and how to make our officers more empathetic, and using empathy and putting themselves in that person's shoes and in the family's shoes, and so on, and the kids' shoes as well. And we also go from there, and we have training and updates each year, legal updates as far as law enforcement is concerned, on opioid addiction, as well as classes that we can go to on how to identify these drugs, how to respond to these drugs. And we also train in Narcan use and assign our officers these Narcan, and which is Naloxone, as well as allowing them to work these investigations. I say myself, as well as most of the officers I've seen, we look at it, we have a passion for this, and it's because of us looking at this opioid epidemic as a crime that has victims and not victimless crime as that. So we try to show a lot of compassion, a lot of empathy when it comes to this. As far as things that could be done better, I say that across the board, we can show a whole lot more empathy in this. We're starting to do that now by changing how we view these opioid overdoses and crimes itself. We're trying to educate the user and the families as for resources that they can use and how to try to recover from this. And we use our resources more and try to partner with other people in the community and other departments as well, and providing resources and education as well. So I think that if we start with being more empathetic and showing more compassion in this, then, as you said, not having this just as a job. We need to look at this and say that it takes a village to get this thing done. It takes everybody together to partner together to see that this thing is an epidemic and a problem. And I think that if we work together, we can get this thing done.
Thank you so much. Jeff, could you add respond to the same question, followed by Sheriff Woodard?
Yes, my response would be just an applause to our law enforcement for the training that they do and the way that they do tackle this crisis that we're in. We work with CIT, with our law enforcement, for training around the resources here in the community around RC3, the Hope Alliance, and what the coalition offers. As well as I'd like to applaud the fact that Narcan is so readily available and that all officers are trained to use it. I think that's one of the most important things, is having that available if an overdose or a crisis does occur. Because another piece of that is with Narcan is that many people think you hit them once and everything is done, but that overdose may not be over. So that proper training comes into play immediately. So the only thing we would like to add is just applauding our law enforcement here in Wilson County and for their dedication to help us fight this crisis.
Thank you. Sheriff Woodard?
And I'll make mine real quick again. Definitely like what Sergeant Turner says, as well as Mr. Hill, every law enforcement officer, as well as every detention officer within 6 months, has received crisis intervention training, which assists them in dealing with anyone who has substance misuse disorder. And I thank God that we may have 4 or 5 out of about 168 employees who hasn't been through that training. So we try to make sure that we keep that readily available so that they can know how to deal with people, not just go to the home if we have a situation, whether it be a domestic or anything of that nature, where first thing we think about hands-on, going in and arresting them. Try to sit there and have patience and try to see what the problem is. And again, try to be mindful of all the resources within the community so we can be able to present that to them. Every year, I always send out a little thing to all the deputies where they're familiar with all the resources within the community. So if someone asks them the question, it won't be one of those things where I heard or I don't know. We try to have a deputy on each panel. I know we have someone to represent us with the Substance Abuse Coalition as well. And overall, try to do whatever it takes to try to, one, keep us educated, but also work hand in hand with all our other stakeholders so we can try to, again, prevent this problem from getting any worse than what it is.
Thank you so much. And Deborah, the Honorable, would you like to
I wanted to,
respond?
yes, I just want to add and just kind of reiterate, everything seems to go back to education and training. That's important today. Educating our officers, our families, training our officers and our people that are, families that are involved with the people that are addicted. It always goes back to that. I think a lot of times things happen because we fail to know, we lack knowledge. So getting those pieces out there, letting them know where the resources are. I just want to reiterate that all the time if I can. That'll be my, I guess I'm gonna be the one waving the flag constantly about educate, 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 and communicate, and let them know that the resources are out there for them.
Thank you so much. Jeff, I'm gonna lead off with you first on this next question. Why is substance misuse common? And what are some of the underlying factors?
So substance misuse is prevalent because of the underlying factors, for lack of better terms.
Okay.
When we dig into this, we're digging into the roots of addiction. We're looking at the primary cause, which is really what we need to. We look at addiction like a weed. If we pull it at the top, it's just going to grow back. We have to hit it at the root and the source. And there can be a ton of different things that play into this. First and foremost, I do want to touch on the pandemic. With isolation and social isolation, not only have we seen new people beginning to use, but also people returning to use that were in recovery. Because of a loss of a support system, the lack of meetings, even virtual things have not worked, but for some they do. It's just dependent on the person in particular. But the pandemic has put a huge strain on our recovery community, as well as treatment and availability options for those that may be in active use or suffering from disorder. There's also genetic pieces. The addiction can be genetic. What we figured out and what we've seen is that studies show that heredity of a disease is at 30 to 70%, depending on the substance that's misused. And they can go along with specific genetic disorders such as PTSD, depression, anxiety disorder, bipolar disorder, all the way to schizophrenia and ADHD. Environment is everything. Environmental factors play a role in all of our lives, and that is the same for those that may be in active substance misuse. Being raised in a home with parents or other relatives that misuse alcohol or drugs. Living in a neighborhood and going to a school with a high prevalence of alcohol or drug misuse is a risk factor. And then a significant environmental risk factors for both substance misuse disorders include easy access to inexpensive items such as alcohol and other substances, making sure that our community is properly carding, IDing, ensuring that our youth do not have access to these things. Heavy advertising for alcohol and tobacco. It's hard to drive down a highway, much less go in a store without seeing some sort of signage for a medication or alcohol or some sort of tobacco product. Family conflict and low level of parent monitoring can become factors. There's also ACEs and childhood traumatic experiences that can lead us down that path later in life. We also have peer pressure. Peer pressure plays a huge role, especially as our youth grow and they begin to prosper all the way through college and even us adults. One thing that we constantly share is that, if somebody abstains from something, don't question it, just go with it, support them. Make sure they know that they're welcome to not have that drink, to not take that pill, to not do these things, that they have this system of support around them. And then finally, again, the other piece is the resource availability. Making sure that somebody who is suffering, whether they have insurance or don't, whether they live in a high income neighborhood, or they live in low income housing, that everyone has equitable opportunity and equitable right to get the treatment and provision that they deserve. And that plays a huge role in what substance use disorder really is, why it's common, and that's a main factor as to how we need to move forward in addressing this as a crisis in and of itself.
Thank you so much. Sheriff Waters, can you add to that also?
Yes, ma'am. I definitely see when the substance use common. I'll see a lot of the factors as personally from a law enforcement perspective is availability. You know, there's a lot of things going on within this country, within this world, and I think a lot of people are looking for other means to try to get them through it. Just like, you know, someone would take a drink or get intoxicated, thinking that maybe this problem will be over, and then when the morning comes, that problem is still there, along with the hangover and the headaches. But the availability of these drugs within the community, and I know we do have one of our detectives who work with our pharmacies within the community to try to ensure that, you know, if someone goes doctor shopping or goes using false receipts to go in there to obtain drugs or whatever it may be, to try to compare that with other areas, other counties, to ensure that they don't come here to Wilson County or Wilson resident goes to Greenville or where it may be to try to obtain some different drugs to, you know, help their habit or to assist that habit. But again, I always consider them victims, and what we're doing is trying to assure everything we can to try to prevent this from occurring. But we may, you know, I feel strong that the law enforcement in Wilson County is doing everything they can to prevent a lot of this stuff. And I know arresting is not the way, but through the programs, through getting rid of the dealers, because we've always taken strong programs towards preventing drugs within our community. But again, there are some areas throughout North Carolina that are suffering, that a lot of our people are going to those areas and bring those drugs back here, whether it be in trafficking amounts or just for their own personal use. And then once they get back here in Wilson County, if they overdose or whatever it may be, it just places statistics on our county, whereas it's not our county that's possibly the one that's suffering. So again, I see some of the underlying factors as being, you know, not, you know, what's going on personally within people's lives, and then also the availability of these drugs within not necessarily Wilson County, but other areas.
Thank you so much. Sergeant Turnage, is there anything you need to add?
Yes, Sheriff Wood made a good point about the availability. That is absolutely correct. Also, Mr. Hill also made a good point about the advertising and it's being visually stimulating for people. The availability is huge. I would say the drug carfentanil itself, and I say fentanyl and carfentanil a lot because we're noticing when we send this stuff off to the lab that it has a large amount of that, whether it's cocaine, crack, or pills that's being cut that's sold for as oxy or codone or hydrocodone or something like that. They're being cut with this synthetic drug, and that's where you're seeing most of your overdoses. Carfentanil can be ordered. This stuff can be ordered by the kilos, and it can be ordered at a much cheaper amount than, say, heroin or anything else. Or if you look at it, you just can't go to the doctor's office and knock on the door and say, hey, let me get a couple of pills of Dilaudid or something like that. You have to be able to get a prescription for that. And you have to be able to get fentanyl and from the doctors or a pharmacy. But this stuff is available to be ordered across our nation here, across seas as well. And this stuff comes in a large quantity, and a large amount makes a lot on the streets here. So the biggest thing is availability, and I agree on that.
We're getting ready to close up because we could continue with all of this wonderful information, because you have truly blessed us this afternoon with your expertise and your knowledge. But there's one last question I want to ask. Where do we go from here? And I'm going to start with you, Sheriff Woodard. What can the community do? And the resources are here, and you guys are doing an excellent job, and we thank you for taking care of Wilson County. But Sheriff Woodard, let's start with you. Where do we go from here?
Well, I really feel like that we're doing a lot. The community in the whole is doing a lot to try to prevent this poison from taking over our communities, affecting our lives, our families, and our children. I still always go back to the issues of there's a lot of things that's going on within people's lives that cause people to make certain choices and certain decisions. And I strongly feel like when the mental health clinics is closed here in Wilson County, when the mental health places have closed throughout the state, it had just opened a large door to where people thought, well, okay, well, what do we do with these people who have these depressions or these issues, whether it be family or psychological, whatever it may be? Well, let's lock them up. Let's place them in jail. And the detention center is not the place for people who have mental issues. And by doing that, all it's doing is just showing that person that no one cares about me, no one's trying to help me other than whatever the resources are that they may get at the end, or whenever something detrimental happened in their lives, in which then they change their lives, or they get sick to the point, or they get close to death, where it gets to a point that now I made it, I want to change my life, and have a good family support system, because a lot of people don't have that, whether it be poverty or, again, economic or financial statuses. But I really feel strongly, if the mental health issue, it would be looked at more strongly, that would probably open up a lot of doors where these people will have places to go, people to talk to, and not have to spend a lot of money out of their pockets to try it, because everybody don't have insurance. And I can go on, but that, again, that would be my issue behind all of this, is a stronger look at the mental health issue and try to see what we can do to bring that in to help some of these people in the community, and not send them to where they have to pay astronomical fees just to get some assistance.
Thank you so much. Mr. Hill, what would you say? Where do we go from here?
The biggest thing for us and the way that we focus on our community is addressing the stigma that's related to opioid use disorder or substance use disorder in general. We look at things such as medicated assisted treatment with WPS, as we showed earlier, and see that as a viable resource, but there's still stigma around it because it's synthetic opioid that's used, as far as Suboxone is concerned. The other piece is making sure that our community is trained on Narcan. Just like the PD stated earlier, it's a life-saving mechanic, and it's readily available through an organization like WPS, who is funded through us to do community disbursements. The biggest thing, again, is also coming together to share resources, work together and collaborate. The mental health issue is a huge piece, and that's something, for instance, as a coalition, we focus on prevention, treatment, and recovery. It's out of our realm of possibility. But by having our partners with DSS, with the health department, and so many other county organizations, we create a referral system or a warm handoff system. So again, just beginning to continue to come together as a community, and to really just provide these resources together in one unified fashion to make sure that our community knows that we're here, we're available, and we're here, and we're ready for them.
Okay. Sergeant Turnage, where do we go from here?
Yes, I'd say where we go from here is, again, remember that it takes a village to do things. It takes more of an effort, more compassion, more empathy. It takes teamwork. It's going to take everybody. Remember that we're all stakeholders in this. We're all a part of a bigger issue. It's going to take the few of us that's dedicated to this to change this. Because remember, we do this. We do this while we do this. We do this for the innocents in between all of this. We don't do this just for the victims per se. We do it for the victim, but we do it for the innocents. We do it because we have a driving force behind this right here. So I say, if we increase education, as everybody said, and we launch more programs and use our resources. I want to end on this note right here. Progress is impossible without change, and those who cannot change their mind cannot change anything. There's a quote from George Bernard Shaw, and I thank y'all for having us tonight.
Thank you so much. And the Honorable Powell, where do we go from here?
Where do we go from here? I believe, Representative, is to have more forums, to have more of information in our communities, to have maybe more of, I guess, our stakeholders involved with us in this society, making decisions, to bring in as many people as we possibly can to get the information out there, to continue to educate and to show support for one another, to show love for one another. Because we never know, we could be in that same situation with a family member, and to be supportive, to show love, and to let them know that we are there for them, that they are not alone, and to be positive and not negative. With our children in the classrooms, to be positive and let them know they can make it. There's other avenues, as I said earlier, for them if we have to just take one child under our wing, sometimes we can't always reach out and touch every child, but to just maybe make one child a project, to say, if I can help you, give me a call if you need it. If your parents are having difficulty, just to reach out and touch. And I think that will make a difference, because back in the day, you could go to your next door neighbor for assistance and help. And now people are in their home houses. They're scared. They don't want to come out. If anything happens, and if the police go to your house to ask you, you're scared to say anything, because you don't know what may happen in your situation. There's fear. But if we can just, be supportive and reach out and just be of assistance to one another and to show love. I'm a believer in showing love for one another and caring for one another. And sometimes it puts us in certain situations, but if we stick to it and stand together, then it will come out on the top.
Thank you so much. I want to share one thing from the chat, and this is from Candace Roundtree. And you see it in the chat. Wilson County has an opioid multidisciplinary team. And Carol, I can't read anymore.
I just brought the slides back up, Ms. Roundtree. If you want to share your announcement in more detail, you're welcome to do so at this time.
Yes, thank you very much. I was nodding my head at a lot of what the speakers were saying, and I wanted to make sure that everybody who's part of this gathering tonight is aware that we do have partners who are working together. Sheriff Woodard kept saying that we are working together. There's a opioid multidisciplinary team. We are able as community partners to review requests for funding. We're able to get people in treatment. There is always use. Also from the prevention angle, we have a trauma-informed program at Darden Middle School. Principal Jennifer Parker there is wonderful. We're going to be doing biobehavioral feedback with children there. And I think prevention is key. Investing in prevention with young people, getting at those root causes of what adverse childhood experiences and trauma. We also are investing in strengthening our recovery community. We've trained many recovery coaches in Wilson County. You heard Sheriff Woodard reference that. I think you heard Jeff talk about that. I just wanted to just thank you for the opportunity to say that there are a lot of folks at the table. What we need though is resources. We're able to do this work. DSS is able to lead this work because we have a grant. That's what's helping pay for training folks to be recovery coaches, paying for folks to access treatment. And your advocacy, Representative Cooper Suggs, is so needed. If we don't have the financial resources to address these issues, all of those, the housing, poverty, it's just incredibly challenging. We have such a great spirit of collaboration, but if we don't have the financial resources to back it up, it makes then our folks suffer.
Thank you so much. And I just want to say now to thank all of you for all the information that you've shared with us tonight. And speaking now as your representative, open door policy. I know from social services, Glenn and I talked, so therefore we'll be talking some more. Mr. Hill, Jeff, we need to communicate. Then therefore Sheriff Woodard, Sergeant Turnage, then therefore I'm speaking now as your representative. So that just give me information and we'll go from there. Because we know with the American Rescue Plan, with other funds that have been funneled to us, that now is an opportune time to work on some of these programs, because we know the issues with mental health at this point, and that it has worsened because of the isolation, as Jeff said earlier tonight. So I'm there to do whatever I need to do. So we'll talk. If you don't reach out to me, I'll definitely reach out to you. Thank you so much. Take over, Dr. White, whoever's gonna do this next, take over. Okay.
So I just want to say very quickly, we had a few questions in the chat, but I think that the majority of them have been answered. And due to the time, I would just ask that Jeff and whomever has the answer, if you would very quickly take about 30 seconds and just tell them the answer to this question. What can we do to secure meds in our homes? So if you take about 30 seconds, if you're a person that has a response to that, I'd appreciate it.
Oh, thank you, Dr. White. Very quickly, I just want to remind everybody, like I stated earlier, the coalition provides secure medication, lock boxes, lock bags, and cabinet locks, as well as disposal kits for in-home medication at no cost to our community members. We're very thankful that we have state, local, and federal funding that helps us supply these materials. So if anybody's in need and needs a way to secure medication, they can simply get them from us and we can show them how to use them in the home.
Thank you.
Thank you, Jeff. I appreciate that. Our next slide. We'll now have our closing comments first by Ms. Deborah Powell. If you have anything you want to add as a closing comment, and then Dr. Lamont Foster, who's in charge of the program, will close us out. Thank you.
Yes, this has been a wonderful, wonderful forum. The information that's been shared has really, I think, opened my eyes too as to what can be done in our communities. Some of the things that I remembered hearing about looking at signs and symptoms, being able to recognize, because sometimes we are too close to people to recognize that they are suffering. For example, if you have a child that maybe has a change of habit, I've heard that we were talking about change in behavior. They may be ill and maybe hard to deal with at home, and you don't know exactly what's going on with them. There may be a physical health issue, lack of energy, motivation, weight loss, gain, or red eyes, neglected appearance. All of a sudden, they're not taking care of themselves and how they look. Money issues, requesting money for different expenditures more than usual. And just, taking notice of school. Maybe the child's having difficulty at school because a lot of times you find out that if a child is having difficulty, there is a reason. There's reasons for everything, I believe. We just have to find out what's going on with that person. Just take the time. Sometimes we don't have the time, but sometimes we have to take the time to care about our students and see what is going on in their lives. And then sometimes it could be something that it's just a matter of just spending time with them, just taking time to let them know that you love them and you care about them. But just focusing on, as we said, the resources available because we definitely have plenty of resources. We've heard on those tonight, and what we can do, and what she says going on at Darden, and educating our students, educating our parents, as Sheriff Woodard said earlier, and just taking the time to do that. And, right now at Wilson County Schools, we don't have any cases, which I'm glad to say right now, we have, no response of any opioid related disciplinary actions in Wilson County Schools. And we hope and pray that will continue. But, if we do, we will be supportive, and we now have resources and partners and stakeholders that we can actually go to for assistance. So I'm hoping that our community, or the people that are listening, have gotten a lot of information that they can take back with them. And please use it to help other people. There's someone you may know or a friend. In your conversation with your neighbors, they may somebody that knows someone that's going through some difficult times, and just share them and share with them these resources that are available for them. Thank you.
Dr. Foster?
Yes, I concur with Honorable Powell. Say that how do we address and arrest the problem that we're dealing with, regardless of what the problem might be, is facts and not fiction. And this entire panelists that were put together were experts in the field who will provide us with facts and not fictions. Because if you are operating with facts, you can make a better choice or decision on what direction you need to go. And so I am extremely pleased with what I've heard. I want the panelists to know that they have permission to get a recording and share it, because this needs to be heard, that we have such a stellar group of competent, informative, and caring experts who were sharing facts and not fiction. And so if we can get this information to you, you will speak with Dr. White or Mrs. Vitas Neal to get a recording of this, because we're in this together, and we're sharing resources, and we don't have to duplicate what we're doing. We can just make sure that we take the funds and make sure we cover what we need to cover to be more effective and efficient. I'm fortunate to have a board of directors who allow me to move and to not lock me into a particular box at St. John Community Development Corporation. And I'm reminded that we are Community Development Corporation. So what else can we do to help develop this community? And this was the vision that came out of that thought. And then Z. Smith Reynolds providing us with the funding to make this happen. I am pleased and excited about what we have just heard. To all the panelists, to law enforcement, to Jeff, to Ms. Powell, to our moderator, Representative Cooper Suggs. What a fine job she did keeping everything flowing. And so we thank you. We will let you know when our next Community Voices 3 will be. And right now we're about setting up a center for systemic change. And so that's our next project. But I thank you. I thank Dr. Carol White and Mrs. Vitas Neal for their work in organizing this and putting it together in such a strategic way. And enjoy your day. And thank you for attending.
Thank you. Good night, everyone.